Hello and welcome back to A World Without Malaria. In this course, we've discovered that malaria can harm individuals and entire communities. We've also discussed how early detection of a malaria infection is crucial for fast and effective treatment. And you can learn in Chapter 10 how to use a rapid diagnostic test kit, an RDT, and how this is an efficient way to gain that early diagnosis. But what should you do if someone has malaria? Throughout the course, we've explored various supportive treatments, like keeping the patient hydrated and cool if they have a fever, and ensuring that they have good nutrition, and of course, praying for the patient's healing is great. The other good news is that there are also medications called anti-malarials, and they can be used to treat malaria. Usually, a doctor will prescribe the necessary medication, and it's vital to get a malaria patient to the doctor as soon as possible. However, in this presentation, we'll provide you with important information about malaria medications. Be sure to read the manual alongside this video because they complement each other. I hope you find the information helpful. Enjoy.
Hello, my name is Estuardo. Great to meet again. Let's discuss malaria medications. Malaria is a disease that needs to be properly diagnosed so that the right medicines can be used to treat the disease. When someone is sick or suspected to have malaria, supportive treatments such as giving Panadol and fluids should be commenced as soon as possible. But this only treats the symptoms of the disease. They do not fight the disease itself. To properly treat malaria, specific medicine needs to be given to the patient. However, this shouldn't be done until the diagnosis has been confirmed with an RDT or laboratory tests. Assuming a person has malaria, then giving malaria medication without testing should only be done in circumstances where there is a strong clinical suspicion of severe disease and it is impossible to gain a diagnosis using a rapid diagnostic test or laboratory tests. Of course, whenever possible, medication for the treatment of malaria should be prescribed by a doctor, and it is essential that when a person is prescribed medication, they take the full course at the right time of day for all the days prescribed. Malaria has many forms, and unfortunately, there is no one pill that treats all the different forms of malaria. That is why it is important to test the patient and find out the specific type of malaria that is present in their body. Then, the right medicine can be given. When giving medicinal treatment for malaria, the medication type and dosage are based on 5 main factors. Following these guidelines will help in making sure a patient receives the best treatment possible. 1. Determine what the infecting Plasmodium species is. Different medications are used for different species. 2. Determine is the malaria attack uncomplicated or severe. This relates to the number of parasites in the blood as well as complications presented. 3. Is the patient an infant, a child, or an adult? And if the patient is a woman, is she pregnant or breastfeeding? Dosage and treatment vary from different people. 4. It is very important to know what resistance the malaria parasites in the area have to certain medicines, and then to avoid using those medications. And lastly, 5. Connect with local health authorities and follow their treatment protocols. Normally, they will be aware of factors such as resistance levels and common species types, and so they will have recommended medications and treatment protocols. Let's look in a little more detail at these points. As I mentioned, knowing the infecting Plasmodium species is very important for treatment purposes. Plasmodium falciparum, PF, and Plasmodium knowledgely, PK, infections can cause rapid severe illness or death, and the urgent initiation of appropriate therapy is especially critical. Plasmodium vivax, PV, Plasmodium ovale, PO, and Plasmodium malariae, PM, are less likely to cause severe manifestations. Patients diagnosed with malaria are generally categorized as having either uncomplicated or severe malaria. Patients with uncomplicated malaria can be effectively treated with oral antimalarials. However, patients who have one or more of the following, impaired consciousness or coma, severe anemia, kidney failure, significant difficulty breathing, low blood pressure, blood clotting or spontaneous bleeding, acidosis, which is when the blood builds up acid, dark brown color urine, jaundice, or repeated convulsions, are considered to have manifestations of more severe disease and should be treated aggressively with infusion or injection of antimalarial therapy. Some of these conditions can be diagnosed without medical training, but it is sufficient to say that serious illness requires immediate attention. A malaria victim's condition can quickly deteriorate. PV and PO infections also require treatment for the forms of malaria parasites that remain dormant in the liver. These dormant parasites can cause relapsing infections. On top of this, consideration should also be given to the fact that PF and PV malaria have different drug-resistant patterns in different geographical regions. This is one of the reasons to be in communication with local health authorities, as they will have this information. Not completing the full course of medicine can cause parasite resistance to the medications. And even though a patient may feel better after taking only half of the prescribed amount, should the parasite transfer at this stage to infect another person, they can be resistant to a treatment regime, and the new patient will suffer accordingly. Over time, PF and PV malaria in an area can develop full resistance to particular medications, thus making that form of treatment no longer viable. Knowledge of the geographical area where the infection was acquired is important. This knowledge provides information of the likelihood of drug resistance by the infecting parasite, making the choice of an appropriate drug or drug combination and treatment possible. In addition, if a malaria infection occurs even though a person has been using an antimalarial for the prevention of malaria, then that drug should not be part of the treatment regimen. Most medicines for uncomplicated malaria are ones you take by mouth. It is important to take the full course of medications as I outlined a moment ago. Most parasites will disappear from the blood within 2 or 3 days, and the fever will clear in 36 to 48 hours. However, if a patient has severe malaria, intramuscular or intravenous IV medicines are used. There are several medicines used for preventing and treating malaria. And when medications are used for the prevention of malaria by protective measures, they are called prophylaxis. It is important to check with medical professionals for the best course of treatment or prophylaxis. I will now give you a quick overview of common medicines used for malaria treatment. You can take chloroquine to prevent PF and PV infections in areas where the parasite resistance of chloroquine has not been confirmed. You can take mefloquine to prevent malaria infections unless the malaria parasite in the area you are visiting is resistant to mefloquine. Do not take mefloquine if you have a history of active or recent depression or other mental illness, seizures, or some types of heart rhythm problems. You can take doxycycline, which is an antibiotic if you cannot take mefloquine. However, women who are pregnant and children younger than age 9 should not take this medicine. Meleron is a combination of two antimalarial medicines. Meleron is taken to prevent malaria caused by PF malaria and can be taken by children and pregnant women who can take doxycycline. When treating people, pre-existing health conditions need to be considered. People at higher risk for having complications are the pregnant, elderly, very young, and anybody with a weak immune system. Different medicines may need to be prescribed for people in these different groups. Drug resistance in the geographic area where the infection occurred is also an important treatment factor. The medicines used may change as malaria parasites develop resistance and as new medicines are developed. For instance, in many areas, PF malaria is resistant to the drug chloroquine. Quinine is often used to treat severe malaria and patients who are pregnant. Quinine can cause hypoglycemia, so the patient's blood sugar must be monitored and IV glucose is given if necessary. Some of the most effective treatments against PF malaria are drugs known as artemisins. These drugs are made from the Artemisia annua herb. This herb has been used for centuries as an antimalarial in China. The most well-known artemisinin drug is called artesunate. Artesunate comes in different forms which can be given to the patient in different ways, depending on the type and severity of the malaria and the type of patient. For example, a child of pregnant woman. It can be administered orally for uncomplicated malaria, intravenously IV for severe malaria, and intramuscularly IM, or even rectally. Artesunate is a very effective treatment for PF malaria. The World Health Organization recommends that it be used in combination with other antimalarial drugs such as doxycycline and mefloquine, or combined with clindamycin for children as well as for pregnant or lactating women. When artesunate or other artemisins are used with another antimalarial drug, it is called artemisinin combination therapy, or ACT. It is generally recommended that wherever possible, PF and PK malaria should be treated with an artemisinin combination therapy. Some premixed ACT combinations are commercially available and go by various names. A single dose of primaquine following an artemisinin combination therapy can reduce falciparum parasites. However, this must not be given to pregnant women. Primaquine should also be given to prevent relapses after cure of PV and PO malaria. Malaria infections caused by Plasmodium vivax, ovale, and malariae can be successfully treated with chloroquine in most places. In many areas of the world, PF malaria needs an artemisinin combination therapy or other special treatment in order to effectively combat drug resistance. If the diagnosis of PF malaria is suspected and cannot be confirmed, or if the diagnosis of malaria is confirmed by species determination is not possible, antimalarial treatment effective against chloroquine-resistant falciparum should be initiated. The World Health Organization has begun to recommend malaria vaccines among children living in regions with moderate to high PF malaria transmission. The vaccines are new, but seem to significantly reduce malaria among young children. The availability of these malaria vaccines in the future is expected to make broad-scale deployment a reality. Okay, wow. This talk on medications has been designed as a brief overview, not so that you can treat someone with malaria yourself, but to give you familiarity of some treatment options so that you can better support your community in the fight against malaria. You can do this by encouraging people in your community who have malaria to seek medical care urgently and to take the correct medicine for the correct amount of time. This overview helps to show you that there is no one medication to treat all types of malaria. There are many things to consider, such as the species of the malaria, location of the patient, severity of the disease, is the patient a child or pregnant? All of these things will help determine which treatment is most suitable. It goes without saying, treatment by a trained doctor is best. As you can see from this overview of medications, it is important to gather the correct facts at the time of the diagnosis and to refer to current information in order to prescribe the appropriate treatment regimen. Severe PF and PK malaria will require much more expertise and supportive therapy for treatment. The good news is that if the correct diagnosis is made and the correct treatment is started quickly, the management of uncomplicated malaria is relatively straightforward. As was mentioned at the start of this video, it is important to seek medical help when a person has malaria and to take the correct medicine for the correct amount of time. But by being aware of the diagnosis and treatment process, you are far more equipped to support your community in the ongoing battle against malaria. 2 more points before we go. Firstly, there are a lot of fake malaria medicines on the market. These are very cheap and claim to cure malaria, but they don't. And people can die if they take them. Read what we say in the manual about fake medicines. And finally, let me say one last time, it is really important that people take all the medicines they are given at the times they are supposed to take them, for all the days that they have been told to take them. Drug resistance can be caused if people do not follow these simple rules. Take some time now to review your manual, and I hope this information helps you in creating a world without malaria. Bye for now. Nos vemos.